From Maimonides to Mother Teresa, Florence Nightingale to Father Damien, people of faith ministering to the sick have seemed larger than life, impossible to emulate. Today, though they may wear heels and baseball caps, kiss their children, run to appointments, and celebrate with colleagues, they are equally committed to the health of their community, since we are all part of the greater whole. Few issues are more polarizing than health care. Who will pay? How much? What would it cover? But people of faith who are on the front line, caring for the sick and protecting the healthy, have one unifying mission: to minister to those who are suffering by providing physical, mental, and spiritual support.
People of faith are more likely to volunteer, more likely to give money for the poor and the sick. And that's really a core teaching within many religious traditions. And this is really what I think it means to be religious and living out one's faith. That as we care for those needy around us, we're actually caring for God Himself. And of course, that has eternal significance.
What we found was the worst possible tragedy could be redeemed into the greatest possible joy in our life.
They told us that even though this is terrible and it's a tragedy, we're going to get you through it. And really, that's what you want when you're going through those dark times, is you just want someone to say, I've been here before and I'm going to get you through it.
Eternal Father, I offer you...
Sister Judith Ann Duvall has devoted her life to making sure there is support during those dark times. As the chairperson of a $5 billion healthcare system made up of hospitals, clinics, and nursing schools, her work impacts hundreds of thousands.
You see the need to have a service available for people that speak so strongly and loudly about the sacredness of all human life, and to garner people to come into that mission with you and share it and make an impact on the lives that you care for.
Sister Judith Ann was aware of her love for the church from an extremely young age.
I can actually remember being in first grade, and I was being prepared for my first Holy Communion, and the sister told us that it was such a sacred time that when the Lord encounters you in that special way, that you should think about what you want to tell Him. And so I thought of it, and I remember so clearly what it is I said. I said, God, help me to always be good, to love you always, and when I grow up, make me a sister. The plantings are sure pretty.
So right out of high school, she entered the Sisters of the Third Order of St. Francis, which recently celebrated their 135th anniversary of caring for the sick.
Their main focus was health care, and there was that inherent love in my heart because it seemed so focused as a way to really give your life to God by serving those who were sick, poor, injured, aged, and dying. And so the two began to come together, and I just felt more and more drawn to it.
Sister Judith Ann served as a nurse, obtained a master's in theology, but the order had less traditional plans in mind.
They knew that I had potential to serve on our corporate boards, and so they sent me to Bradley University here in Peoria, where our community's home base is, to pick up an undergraduate degree in business and management administration. And that's what's so neat about religious life. You give yourself to Him, you let Him use the gifts and talents He's given you in whatever way He wants, and then He places you there where you can impact lives for good.
Some people have difficulty, I think, seeing a religious sister as the head of a corporation as well as a religious sister because they have a preconceived notion that they should be in a cloister, in a habit, behind the doors, and only being seen in the movie image of what a religious sister is.
How long have you been here?
And I think that's somewhat passé. It's really an old image of really what religious and what the church is trying to do in the modern world.
To ensure that everyone had access to care, 40 years ago, the order began the OSF Sisters Community Health Care Center.
Hi, are you Dronell? Yeah, and your mom and brother?
What we don't want to happen is that they don't come because they're afraid. They can't pay. That's so offensive to our sisters because we think individuals who find themselves in this position in their life, for whatever reason, aren't they the more needy of all?
Does it hurt when we touch it?
That would be the saddest thing in the whole world. In God's eyes, do just the people who can pay should be loved and cared for at a time of need? I don't think so. Each and every child has that right to be cared for and to receive the health care that they need.
We see patients from all walks of life. Patients, we say, that probably may not otherwise get primary care health care because they do not have the ability to pay.
If our ultimate purpose is to be there to be a blessing and to take good care of our communities, then that's the focus, not that we just cut a bottom line. God never said that when we were founded 135 years ago. Rather, he said to our founding sisters, never turn anyone away. I send to you for care. That's the foundation. Every human life.
Hail Mary, full of grace, the Lord is with thee. Blessed art thou.
In or outside hospital walls, Sister Judith Ann sees the value of everyone's contribution.
People don't realize the good that they do because they do it so naturally, and they say, of course, why would I do it otherwise? And in fact, their actions, one on one, impacting another life, that life impacts another, that life impacts another. They have an endless stream of good.
That impact was felt by OSF staffer Nathan Carr and his wife Rhiann upon learning their son Caleb would be stillborn.
I got a phone call, and it was Rhiann on the phone, and she was hysterical. And she kept saying, he's dead, he's dead. Our baby didn't make it. And of course, in that instant, my world came crashing down. All of a sudden, the worst case scenario happened to us.
For me, I found the most comfort when I walked onto the labor and delivery floor and checked in and was greeted with 2 nurses that night, and they just took care of me. They told me, I mean, when something tragic like this happens, I told Nathan, I didn't know what was up and down. I didn't even know my name hardly. It was just, it just hit you that you're carrying a child that isn't going to live.
Oh, is that a boat? Does it move? 10 months and 10 days after Caleb was born, we checked into the hospital, and I call it the reassembling of the dream team because our entire medical team, on their own initiative, came back together so that we could deliver Abigail. And her eyes and her smile, we often joke, have come straight from heaven.
Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done.
Our healthcare system is right in the service of human life that is in the image of God. God still works through each of his creations to touch the lives of others. Again, that's not a nice, warm, fuzzy thought. It's actually a truth and a reality. What is important is that each of us accomplish the good that we can wherever we are, and our whole world becomes blessed by it.